I'm Kristen Mattson. I'm the Director of Home Care at GVNA HealthCare, a nonprofit organization serving 39 communities in the state of Massachusetts. We are one of the oldest provider organizations in the state. In April, we will be turning 110. And I'm happy to talk with you today about the services GVNA HealthCare offers. We offer programs for young moms, first-time moms. We have a program called Healthy Families that provides support and education to expecting moms. We run a diaper pantry. We have a food pantry. We do private duty in the home. We have adult day health centers, and we also do traditional home health care. Really, honestly, when people ask me what nonprofit means, in this healthcare climate and culture, it means that we're not an organization trying to make 2 + 2 = 7. We have a very quality-oriented mission. We're focused on a very high level of service to our consumers and customers. At GVNA HealthCare, our mission is to provide a very high quality of care in a fiscally responsible manner. Some of the services are expensive. Private duty services potentially can get to be expensive, but we do try to, contain costs and be able to offer a very, very high standard for a very, reasonably low cost as compared to some of our competitors. A lot of our programs are covered by insurance, though, so specifically the home health care is typically covered by insurance. And when we have a community member that is in need of such services, we do occasionally enter into free care situations or a reduced rate of reimbursement. I think there's a growing need for home-based services in the community. We have goals of keeping people out of the hospital and helping people remain in their homes at the highest, safest level of function, avoiding hospitalization, avoiding nursing homes. We look to support not just the patient but the family as well, and sort of bring together the community resources to help to optimize people in their own environment. Home health care has really evolved in the recent years. Home health care used to be a setting of care for providers where once someone went into the hospital, had a spell of illness or an injury, they would usually transition to a facility for a period of time and then come home at a fairly high level of functioning. And so in years past in home health care, clinicians were entering the home to sort of do the fine-tuning, if you will, in the process. Today, home health care looks entirely different. Oftentimes, people will go into the hospital and have an injury or an illness and come straight home from the hospital. And sometimes those hospital stays are not long. So the acuity of the patients that we're caring for in home health has really evolved. And so the skill sets of the clinicians that are going out into the homes needs to evolve with, because we really want to make sure that people are able to recover at home, but that they're safely and properly supported. So we have a team of highly skilled nurses and therapists who do perform assessments, if you will, and establish goals with the patient and with the caregivers involved. Where do we need to get that person back to? What are the goals of not just the clinician but the patient? What does this person need to be able to do in order to stay home safely without experiencing a fall or being at risk for a decline in function or an exacerbation of a chronic illness? A lot of times our nurses are critical in going and doing home visits and providing service to patients with chronic diseases such as congestive heart failure, diabetes, COPD, where without that occasional monitoring, education, and teaching, symptoms can be developing that aren't recognized just by family members. And so if left unrecognized, a hospitalization is almost a guarantee, whereas the nurses are really skilled at teaching patients and family members how to look for those early symptoms and how to mitigate the risk of having to go into the hospital and then playing catch up to an issue that grew bigger than it needed to. In terms of therapy, physical and occupational therapists really work with the patient to get the highest level of functional performance, make recommendations around the home environment, identify fall risks, identify, in a strategic way how things might need to be set up to sort of optimize safety and performance, and also do that education and teaching with the family members as well. I think that it's very important for people in the community to understand what home health services look like and entail, because there's a misconception, especially among older community dwelling people, that the home health clinician might be the person who decides that they have to go to a nursing home. So there's a lot of anxiety and fear in allowing that person in who may make the decision that you have to go out, and that's the absolute opposite of what we do. Home health is committed to keeping people in their home environment, and we want to set people up for success. An indication for a home health referral can be as simple as just picking up on a very slight change in someone's performance. If someone is demonstrating some difficulty getting out of the home, you know, a person that used to be able to be fairly active in the community or get out and access the community is now demonstrating difficulty with that, or is requiring some assistance, be it a cane, a walker, or a person holding on to them. Or if just a family member notices that their loved one is just not quite as strong or as vibrant. Usually when we get an order or a referral and our expert goes out and does that assessment, the initial cue that prompted it is really just the tip of the iceberg. It's usually when the nurse or the therapist goes out to the house that they really find the bigger underlying issue that may have been a problem. The frequency of home health services is very individualized and tailored to the needs of the specific patient. It's no longer days of old where everyone got a home health visit 2 times a week. Again, we see such a difference in acuity of the home health patient that we really have to customize our interventions and our plans of care. So we have some patients that require very little, that are almost on more of a maintenance program where we may be in once a week or once every other week. Then we may have a patient that requires a considerable amount of service that we may be in 3 consecutive days in the beginning, or 5 times a week, or 4 times a week. It's highly, highly individualized. An example of one of those cases would be, for example, a total knee replacement or a total hip replacement patient. Oftentimes now, they go into the hospital, have their surgery, and they're coming home the next day. And so it wouldn't be sufficient to just go see that person 2 times in 1 week. You know, their knee might freeze up and their outcome would be jeopardized. And outcomes are really important in home health care. We have a lot of regulation and we do a lot of data collection, and we look at our agency's performance as it compares to state and national averages on specific outcomes related to clinical care and patient satisfaction. And I'm thrilled that GVNA HealthCare's outcomes exceed the state and national averages in just about every category. The length of a home health visit is variable to a degree. The national average, for example, for a home health physical therapy visit is 43 minutes. Here at GVNA, we average a little bit longer than that. It's typically between 45 minutes and an hour. Certainly if we're in someone's home and there's something going on and we need to be making calls to the physician and facilitating some coordination of care, that visit may be longer that day. So there's no set rule, but as a general, a visit is about an hour. And in terms of how long a patient receives home health services, it's really defined by how well they're doing along the way and their rate of progress and when they achieve those goals that are established at the beginning. Some people have home health services for a few weeks. Some people have for months and months. We typically work within what we call 60-day episodes of care. And if we still deem that a person needs services beyond 60 days, we'll do what's called a recertification. And that's an involvement of the physician to say, this is where this patient's at, we would like to continue, and we're going to go on into another episode, and then so it goes from there. We have patients that recert multiple times. But again, we also have the very short-term home health patients as well. It's very individualized. We also have certain niche areas of expertise, one of which is wound care. We do have a certified wound and ostomy nurse on our staff, so we're able to handle the very complex cases where we have wounds that require a higher level of assessment. Once the goals are achieved, we make a decision on whether it's appropriate for home health to progress goals and continue, or whether it's appropriate to transition the person to a different level of care. And that's where at GVNA HealthCare, having a diversified portfolio, if you will, where people can transition between home care to maybe an adult day health program afterwards and beyond. Sometimes people transition to an outpatient therapy program. So it just depends on where that patient is at physically and medically and functionally as to what setting is the most appropriate. In home care, we do have to follow Medicare guidelines, and home care is a benefit that's extended when a person is considered quote-unquote homebound. They are able to access the experts, if you will, coming to their door. But once the person is easily able to get out of their home and re-enter the community, it's no longer appropriate for home services to be going out to the home, and that's the point where we would make that transition. Home health care is most successful when the whole village is involved. It's the patient, it's the caregivers, it's the family members, and a major role of the home care clinician is teaching and education. And one of the things we really pride ourselves on at GVNA is providing a high level of support and education to family members and caregivers so that we're setting that team up for success when we finish, that we have a confidence that people are going to be able to manage just fine after we've done our due diligence with instruction and support. It's not a passive process. Sometimes we have patients who think we're coming out to the house and we're going to fix them. They need to understand from the get-go that there has to be some level of engagement. Sometimes there's even homework to be done in between our visits, and it's an entire community process around this one person's goal. Depending on the discipline, whether we're talking about a nurse versus a therapist, the benefits are far and wide, but the overarching benefit is an expert at your door taking a look and identifying a potential problem or risk area before it impacts you and you're in the hospital as a patient. So if it's a nurse and you have CHF, that nurse may be noticing that your ankles are a little bit swollen or that your vitals are a little bit off. A therapist may notice that you're catching your left toe every time you take a step with the left foot and you're at risk to fall and break a hip. So it's that early intervention aspect of it that really we see the most benefit in terms of home health. Obviously, if something happens, a person goes into the hospital with that hip fracture or a congestive heart failure exacerbation, we are the experts that come into the home after the hospitalization, check vital signs, make sure that things are stabilizing, gradually build you back to your prior level of function with, close monitoring and a lot of collaboration with the doctor and the other members of the care team. I think home health care is critically important because as a country, we are in the midst of healthcare reform, and there's a lot of confusion among patients in the community and people in general in terms of the future of healthcare and what is the best setting and what is the best way to provide care. And what's nice is that during these changing times there does seem to be a shift and a focus more towards preventative, proactive health and wellness. And home care has a critical role to play in making sure that our community dwelling elders do not get into the hospital and then the nursing home. Home health care of all of the post-acute settings is the lowest cost environment of care, and everybody wants to get better at home. If they are safe and properly supported, the benefits are that they're not exposed to infection like they are in a facility. They're in their own bed, they're on their own schedule, typically with medications and such, and we do see that people do recover beautifully in the home environment when they have competent and proficient support. For agencies that provide home health care, we used to work under a reimbursement model that essentially you were reimbursed simply by how many visits were provided. And there's been an initiative underway for a few years that's really starting to take effect now, where reimbursement is more predicated on your quality of service So you could have organization A and organization B, and A provides 6 visits and B provides 6 visits, and they're both getting the same, but one patient improved dramatically and one really didn't, or declined, or went into the hospital. So it wasn't a valuable system in terms of ensuring quality. And as we move forward, the home health industry is now going to be reimbursed based upon performance and outcome measures that are tied to quality, as well as patient satisfaction, which ties to your level of service. Another aspect of home health care that we offer at GVNA Healthcare is telehealth. And telehealth is monitoring via devices that we install into the home of vital signs and heart rate, blood pressure, and we're able to sort of symptom manage without even being physically in the home. So once you're under our umbrella of care, we're sort of always there, whether we're physically there or not. We're watching and checking and seeing how you're doing. And I think that that is one of the programs that really translates to our outcomes. And we have, a low return rate to the hospital as compared to some other agencies in the area, and a very, very high level of improved function and patient satisfaction. Patients receiving home health services are generally happier because they are at home. Sometimes that works against them though, and we find that when we go to do initial evaluations, they've just come out of the hospital, they feel great, they're so happy to be home, and I'm fine, I probably only need you a little bit, and this is my son and he's going to help with this, and this is my neighbor and she's going to help with that, and then we come back a few days later and now things look a little bit different, and the patient's actually maybe struggling a little bit, and all of the help that was going to be available is nowhere to be found. And so sometimes I think it's fair to say that everyone does prefer to get better at home, but we really have to authenticate how much service is needed and how much support is in place and happening versus promised sometimes. One of the things that I love the most about home health care, and there are a lot of things you're probably getting that I love about home health care, is that it is really the only setting where, as a provider, you're able to be with your patient one-on-one without a hustle and bustle of a facility and alarms and bells and call things going off, where you're able to really just engage one-to-one and work with a patient in their own environment, which has so much meaning. And when people are at home and you can actually look around and see what do they need to do. It's one thing to be in a facility and say, I want this person to be able to walk 100 feet down this hallway, versus say, actually this person needs to be able to walk 300 feet to retrieve their mail. It's just the environment where there's so much meaning and there's the ability to establish such a nice rapport with the family and the patient. And a lot of the business, if you will, that we do at GVNA is repeat or return or word of mouth, because someone has had our organization involved in their care in their home and has very positive things to say, and they spread the word about what a nice experience it was.